Hello, everybody, and welcome to our webinar. Good day and good evening. My name is Lamia Al-Hazzani. I'm the Patient Empowerment and Capacity Building Manager at the Saudi Patient Safety Center. You'll be hearing a presentation today from Mr. Hussein Jeffrey, Ms. Helen, Haskell, and Ms. Regina Kamoga. They will be speaking to us about patient empowerment and community engagement in patient safety. I'll be introducing our speakers today. Mr. Hussein Jeffrey is the founding director of World Patients Alliance, a global patients alliance. He has been very active in this field, patient safety, and has been the former vice chair of advisory group of WHO's Patients for Patient Safety program. Hussein also founded Pakistan Patient Safety Initiative and has been working towards several patient safety initiatives. The government of Punjab has also nominated him the pivotal voice person on patient safety and quality and give the responsibility of developing patient safety and quality services of the health sector of Punjab province. He is an experienced speaker and resource person and has published several publications in international index journals. Moving along with Ms. Helen Haskell is an American patient safety advocate with 20 years experience. She is a published author who has worked in all aspects of patient safety across a wide range of settings. She is a former co-chair of the ad hoc advisory group for WHO Patients for Patient Safety and led the patient and the public working groups for the WHO Global Challenge on medication safety and the Global Patient Safety Action Plan. And Mrs. Regina Miriam is a patient safety champion under WHO for Patient Safety, CC, and has been involved in several patient safety activities at community, national, regional, and international level, working with key health stakeholders. She has served on numerous health advisory committees and boards at the national and international level. She is a board member of the World Patient Alliance. She is also a member of the Uganda Ministry of Health Technical Working Group on Standards, Compliance, Accreditation, and Patient Protection. Now, moving along to our session, please welcome Mr. Hussein Jeffrey. The mic is yours, Mr. Hussein.
Thank you very much, Lamia, for providing me this opportunity. I'm also very thankful to Saudi Patient Safety Collaborative Center for providing us, all three of us, the opportunity to talk to the healthcare providers from within the EMRO region. So I will be talking about, giving you an introduction to patient safety and what Patient for Patient Safety program is. So, but before I start my presentation, we have some polls, some questions, some basics on patient safety data. So I would request Lamia, can you please have the first question? So I request all the participants to please answer. Okay, so 60 people have responded. All right, 65. So the majority, 51% believe that it's 10,000, 38% believe it's 7,000, and 12% 4,000. All right, so I'll give you the exact answer, but in my presentation. So Lamia, can I have the second question as well now? Okay, so how many incidents of errors and harm occur due to unsafe care in hospitals in low and middle income countries every year? So what is the number? Right, so the majority believe it's 142 million. The second number believes in 146, and the last one is 134. All right, thank you, Lamia. Lamia, can we have the next question? Yeah. So how many patients die due to patient safety issues every year in low and middle income countries? Mm-hmm. It's quite a close competition here, isn't it? 20, all three, or 28%. So it's nearly, it's all divided into three parts. All right. So let's see what the correct answer is. All right. So Lamia, can have the fourth question as well. So patient safety failures are among the leading causes of deaths and disability in the world. So which leading, 5th, 10th, or 12th leading cause? Okay, so the majority believes it's a 5th leading cause. And second is the 10th leading cause. All right. So one last question, Lamiel, the next question. Yeah. So what percentage of patients are harmed while receiving hospital care in high income countries? All right, so the majority thinks it's 10%. All right, so thanks, Lamia. We can stop the poll now. Yeah, we can stop the poll now. Thank you.
Yes, you can close the box and then you can see your presentation.
All right. Okay. All right. Thank you very much. So let's see, what are the correct answers? Just a second. All right. So we all become patients at different times in our lives, and we accept that no one should be harmed while seeking care in the healthcare facilities. There's 5 people, die every minute because of unsafe care. and that makes it about 7,000 people die every day due to unsafe healthcare worldwide. And most of these deaths are avoidable. That's the most tragic part, that we can avoid these deaths. 134 million incidents of errors and harm occur due to unsafe care in hospitals in low and middle income countries. So that makes it about 2.6 million patients die due to patient safety issues every year in low and middle income countries. And that's approximately 2/3 of the global burden of adverse events resulting from unsafe care, and that occur in low and middle income countries. Patient safety failures are among the 10 leading causes of death and disability in the world. So it's not only about developing countries, even in the developed world, things are not as they should be. So, so as I said earlier, the patient safety is not a phenomena of low and middle income countries only, but according to the World Health Organization, even in 1 in 10 patients are harmed while receiving care in the high income countries as well. So nearly half of the global disease burden from patient harm originates at the primary and ambulatory care levels. As many as 4 out of 10 patients are harmed in primary and ambulatory care healthcare. The worst part is that the majority of these deaths are preventable, as up to 80% of harm in these settings is preventable. The most detrimental errors are related to diagnosis, prescription, and use of medicine. Lamia, can we have the poll again, the remaining questions? I think I've already gone through one of those. So it's already there. So you've already listened to it, and what do you think? What is the percentage of harm in primary and ambulatory healthcare services? So 70 people have responded. So okay, so all right. So that's fine. So can we have the next question, Lamia? So what percentage of deaths are preventable in primary and ambulatory healthcare settings? All right. Next question. So what is the global cost associated with medication errors? 32 billion, 42 billion per annum, or 52 billion per annum? Okay, next question. Unsafe surgical care procedures cause complication in what percentage of patients? Okay, so the majority believes it's 1 in 4, 25%. And the last question, Lamia. All right, so it's almost split answer. So all right, so let's see what the correct answers are. Lamia, can you please close down the poll?
Yes, it's closed.
Thank you. All right, so let's move on. So medication errors are a leading cause of injury and avoidable harm in healthcare system. Medication errors occur when weak medication system and or human factors such as fatigue, poor environment, condition or staff shortages affect prescribing and transcribing medicines, dispensing and administrating administration of medicines and monitoring practices. So this all result then in severe harm, disability, and even death to patients. Globally, the cost associated with medication error has been estimated at 42 billion annually by the World Health Organization. Unsafe surgical practices is also a big patient safety issue. Unsafe surgical care procedures cause complications in up to 25% of patients, which meaning 1 in 4 patients. Almost 7 million surgical patients annually suffer significant complications, and 1 million of whom actually die during or immediately after surgery. So we know that there are a number of reasons that contribute towards patient harm. And for example, some of these are given here: poor communication, poor operating system, inadequate system, wrong patient, wrong route, wrong diagnosis. So, as patient advocates, we believe that the first principle of any healthcare system is first do no harm. So way back in 2002, the world nations got together at the World Health Assembly and passed a resolution and urged the member states to pay the closest possible attention to patient safety. And as a follow-up to that resolution, in 2004, the World Health Organization started the Patient Safety Program that basically aimed to coordinate, disseminate, and accelerate improvements in patient safety worldwide. And this program has been there for nearly 20 years now, 18 years. And the current title of this program is WHO Patient Safety Flagship. And one of the very important strands of the WHO Patient Safety Program has been the Patients for Patient Safety. For WHO, patients' engagement is a key priority in patient safety. For Patients for Patient Safety Program basically aims to engage patients' voice in all levels of healthcare and provides a platform to patients to provide their input on patient safety issues. It also empowers and facilitates patients and families to advocate for change collectively. Moreover, it also encourages partnership, empowerment, and improved action for patient safety worldwide. So why should we engage patients? Why it is important? So let's visit the Alma Ata Declaration, and which states that the people have the right and duty to participate individually and collectively in the planning and implementation of their healthcare. And we all know that this is not happening. Even today, this is still not the patient's experience on a daily basis. Let's first discuss what sort of challenges are being faced by the health systems globally. We know that the chronic diseases have been on the rise. For example, NCDs have been growing rapidly. Thus, healthcare systems are under tremendous pressure. The world has been aging too. There are more and more older people needing medical assistance all over the world. Technology is also changing rapidly, thus putting pressure on the health system to cope with the growing requirements of technology. And we can see a lot of examples, for example, in genetics and all other places where the technology is really, rapidly growing, and it's difficult for the health system to really cope up with that sort of growth that's there. There is a sustainability challenge as well, which is, a financial constraint. There is high demand on health systems to invest more and more in health everywhere. However, there are only limited funds available. And now, especially now, COVID-19 has really devastated the global healthcare systems. No one health system has been able to manage and control COVID-19. This highlights the need to empower and engage patients. We need expert patients that could partner with the health system and look after themselves in the community. So what are the benefits of patient engagement? What we want to do is to focus on informing and empowering patients. We know that when patients have the knowledge, skills, and confidence to manage their own health and healthcare, they are more likely to make healthy lifestyle choices, make informed and personally relevant decisions about their treatment and care, and they also adhere to treatment regimes, experience fewer adverse events, and use less costly healthcare. Expert patients take care of themselves better and therefore are less reliant on our healthcare systems. So this is a picture of, as I mentioned earlier, Patients for Patient Safety Program, which is a WHO program in which the patients and patient family members and advocates are involved in WHO work. So this group was initiated in 2005. This is the picture of the first workshop that was organized. So 21 patient advocates from 19 countries from all the WHO regions were selected for this workshop and in London. And I was fortunate enough to be part of that workshop as well. And we also came up with the famous London Declaration. So why become a patient for patient safety champion? There are, these are the people who have attended and participated in a WHO patient safety workshop. So Patients for Patient Safety workshop graduates are called Patients for Patient Safety champions. And these are pictures of some of the workshops that have been held in different WHO regions of the world, including EMRO. The picture on the right and top right corner is a picture for the EMRO workshop. So there are some of the WHO patient safety initiatives on which Patients for Patient Safety champions have very actively collaborated upon. The first and very important global patient safety challenge, in which almost all the hospitals that took, world took part. And 5 moments for hand hygiene was extremely successful in bringing down the infection rates and improving the patient safety situation globally. For Patients for Patient Safety champions, very actively contributed to the design and implementation of Clean Care is Safe Care global challenge. Another important global tool by WHO in which patients have been actively involved. This patient communication tool for surgical safety has been a perfect example of collaboration between healthcare providers and patients. So technical messages were drafted by healthcare providers and patients reviewed them and refined these messages. And finally, patients help in disseminating the tool globally. And these are very basic and simple questions that patients have to ask before and after his or her surgery. This is the most recent challenge on medication safety. It's again collaboration between healthcare providers, pharmacists, and patients. So the technical information has been drafted by pharmacists and doctors, and patients have reviewed and helped improve these messages. And once again, patients have been involved in the dissemination of this tool, thus giving it credibility and encouraging patients worldwide to use it. This is, I'm sure you would all know, World Patient Safety Day, which was initiated in 2019, and 2021 was the third year. And the theme for last year's World Patient Safety Day was Safe and Maternal Newborn Care. So champions are involved in all sorts of patient safety initiatives. They have, formed patients organizations and networked on patient safety. They are involved in education and training of healthcare providers as well as patients. They give lectures, presentations, and are also involved in professional programs. Being member of committees, hospital boards, they're also taking part and conducting research on patient safety, patient engagement, empowerment, and all sorts of healthcare issues. They are networking with professional organizations and patient networks and working collaboratively on improving the healthcare systems. So let me briefly share some of the work that three of us are presenters of today's workshop. What we have been doing very briefly. So let's start with my experience. So when I started working in, as a patient for patient safety champion, I realized that I cannot work alone. So I need to partner with other stakeholders, which included NGOs, government, the healthcare providers, media, lawyers. So I realized that I can't do it alone. So I need to have a collaboration of all these people. So way back in 2007, what I did was I contacted the Pakistan Medical Association, and luckily the woman president of at that time was very forward looking, and she said, we should definitely work together, patients, healthcare providers, and other community members. So we formed a group at that time, and we named it Pakistan Patient Safety Initiative. And we have been working since then as a group. And this group has been really growing larger and larger. So, so far we have organized over 12 national workshop on patient-centered healthcare and patient safety, and these have been organized all over the country in all major cities of the world, of the country. Then in collaboration with Pakistan Medical Association again, we have ran the patient rights campaign in hospitals. So we go into different hospitals and we talk to and create, organize sessions for the healthcare providers, and we create awareness on patient safety healthcare, patients' rights. All of these things are, we discuss and we educate the healthcare providers on these issues. And then we also realized that the doctors' training, there was serious deficiencies in doctors' training, because they were not really trained to engage with patients, to communicate with patients, so they are basically trained as clinicians. So their work was only to look at the patient, diagnose, and do their stuff, the medical stuff, but they were unable to communicate and engage with patients. So looking at that, we developed a program, and with the help of the World Health Organization, we developed a program in which we selected 3 medical schools in the city of Lahore. We trained their faculty, and then they went back into their own medical colleges, and they trained their other faculty that then trained the doctors, undergraduate doctors. But the results had been extremely encouraging. The new breed that came out, the healthcare providers, they had a totally different outlook to patient safety, patient engagement, patient empowerment, and the sort of incidences that we used to have in our hospital because of lack of communication between the healthcare providers and doctors, that really decreased drastically. Then the Pakistan Patient Safety Network also adopted one of the tertiary care hospitals in Lahore. It's called Gangaram Hospital. The government had stopped providing free food there. So for the last about 16 years, we are providing free food every day to over 1,000 patients at Gangaram Hospital as well. So this has really created a lot of goodwill, not only in the community, but also amongst policymakers and healthcare providers, that they see, it's just not, it's something there to, just propagate or speak, the patients are contributing, practically as well. We also have been involved in organizing medical camps in different parts of the country. So whenever, especially in the times of emergency, if there's an earthquake, floods or anything, we organize medical camps and provide free medicines. And so far we have provided, medical camp services to over 150,000 patients in different parts of the country. And then, we have been very actively celebrating World Patient Safety Day. For example, last year, we organized a range of activities. This is a picture of our seminar, which was attended by the health minister herself. She's also very keen on patient safety. She even attended the walk that we organized on patient safety. In addition to that, the health department ran a social media campaign along with the patients. We had posters pasted up on all our 4,500 health facilities across the province. And then we also had roadside steamers on patient safety that were put up at different places in the city. Then apart from that, we also organize patients' family sessions at health facilities and communities. So we, in 8 cities of Pakistan, we organize these sessions, in collaboration with the community, where, hundreds and thousands of people were informed about the maternal and safe healthcare services, along with medication safety. So we organize about 750 plus events under this initiative. Now talking about Helen Haskell, she is an experienced as patient advocate. She has remained the co-chair of the WHO's Patients for Patient Safety Advisory Group for a long time. She has dedicated herself to patient safety since the death of her son, young son, nearly more than over 20 years now. She has a leadership role in both consumer-led and professional healthcare safety and quality groups in the United States. She has created many patient safety education material and has published a number of medical journals. She is co-editor of case studies in patient safety, a textbook of patient safety stories told from the patient's perspective. She has also served on a number of public committees and advises on grants in patient safety and patient engagement. She is very active in healthcare education for both patients and healthcare professionals at both local and international level. She remains an active advocate on personal level, offering support and assistance to injured patients throughout her nonprofit organization, Mothers Against Medical Errors. And last but not least, she is a very active member of the World Patients Alliance Patient Safety and Quality Committee, which is quite active globally. Then Regina Kamoga, another very active WHO patient safety champion. I'm sure she's going to talk in length about her experience in Uganda of what she has been doing. So I'll rather, stop here because I'll let her speak on her experience. So in the end, I would like to reiterate the message that healthcare providers and patients need to join hands and work together for the provision of safe and quality healthcare, as it is not possible to achieve without empowering and engaging patients in their healthcare. So there should be nothing about us without us. Thank you very much for your patience listening. Now I request Helen Haskell for her presentation on Global Patient Safety Action Plan. Over to you, Helen.
Thank you, Hussein. Let me just share my screen very quickly and put it on screen share. Yeah, okay. I am Helen Haskell. Hussein and Lamia have both introduced me very nicely, so I will not introduce myself again. I just want to note that my email is here. I'm going to talk about, in the latter part of this presentation, about some patient materials. And if you're interested in those, you can email me if you can't find them online. So let me see. So in this presentation, I'm going to talk a little bit about the history of how we got here, having a slightly different emphasis from Hussein, and also about some of the advances that we've been making with the Global Patient Safety Action Plan and what patient engagement in that plan consists of. So I just want to start by this quote from a healthcare technology specialist in the US who made this comment a few years ago, but it really has stuck. If patient engagement were a drug, it would be the blockbuster drug of the century. And it would be malpractice not to use it, but we don't use it. So we need to, and what he was interested in was the fact that when patients were engaged, their outcomes were so much better. And that has been demonstrated a lot. And what we are trying to do here is to, is to make that part of daily life. So why patient engagement? Hussein has touched on this, but the patient has the big picture. The patient has information that the provider does not have, not only about themselves and their family members, but also about the healthcare system as a whole, because they see more of it and a different side of it. And patients want to be engaged in their medical care. They don't always know how to ask, and people don't always think to ask them. And then, of course, the informed patient is a better patient, can be more helpful in their own care. So in WHO, there's been a sort of trajectory. This is before some of the things that I'm going to talk about, but starting with Patient for Patient Safety, and then the Integrated People-Centered Health Services, which is a program you can find on the WHO website. And then in 2016, the priority on universal health coverage, which then brought into focus the fact that to have effective universal health coverage, it has to be safe. So Hussein has already mentioned the Patients for Patient Safety. I just wanted to tell you about a few little things that are going on now. We are expanding the network, welcoming more members. They're not just people who have been to the workshops that Hussein mentioned. We're developing new products. We have a patient and family engagement framework that is coming out soon to support the Global Patient Safety Action Plan. We'll have other tools for patient materials for patients to learn more about patient safety. And we are strengthening collaboration with different parts of WHO and different countries. So if you want to join the Patients for Patient Safety Network, and we do accept providers, healthcare providers, they, as long as they have a specific interest in and some experience in or goals for patient engagement. You can go to this link, and I will also be putting this on my Twitter feed, which is at HHASK, HHASK. So you can find it there if this is too long to copy. And another thing that you can do, I don't know if you can see the top of this slide, but it is easy collab at who.in/GPSN, and that is the WHO Patient Safety Network listserv. And you can join that community and get a lot of information emails from WHO if you are not already a member. So some of the global initiatives that have led up to where we are now that include patient engagement. I shouldn't say they're in patient engagement, but they have strong patient engagement component, are these. So to give a little background, just to reflect on it, some of the motivators are the Sustainable Development Goal 3, which ensuring healthy lives and promoting health and well-being requires, again, that healthcare be safe. The WHO prioritization of universal healthcare coverage, again, requires safe healthcare. And the Alma Ata Declaration, which Hussein talked about, also requires patient engagement, self-actualization, and an end to healthcare inequity. So based on that background, WHO began a series of ministerial summits on patient safety in 2016. This is the Bonn Summit. They were London, Bonn, Tokyo, and Jeddah before COVID. So this is the Jeddah Summit, the Jeddah Declaration. There were a couple of declarations. The Tokyo Declaration mentioned engaging and empowering patients and families. And the Jeddah Declaration really took it one step further. It was a very detailed declaration. And it encouraged countries to adopt practical empowerment strategies for patients and families, co-production, and it mentioned patient-centered root cause analysis, which is quite an interesting concept and one that is, I think, really important. Having patients involved in root cause analysis in different ways, but always interviewing them and having a representative. So at the 72nd World Health Assembly in 2019, the WHO passed a resolution that really was based in many ways on the Jeddah Declaration, urging member states to do two things. One, to have reporting systems and learning systems that incorporate the perspectives of patients and their families. That is, to allow patients to report and give input on medical harm and patient safety. And then to work with patients and with civil society, with NGOs and other groups, to use their experience to build patient safety, as well as compensation mechanisms and schemes, that is, disclosure of adverse events and dealing with them in an equitable way. So this was a really important step forward. Oops. Also, it established World Patient Safety Day. As Hussein mentioned, these are pictures from 2019. 2020 was just about as colorful. It has been celebrated widely throughout the world. And I would be remiss if I didn't mention also the G20 Health Ministers Declaration in 2020, which also talked about patient safety and people-centered strategies empowering in both individuals and healthcare professionals to co-produce again and expand the role of patients. So the Global Patient Safety Action Plan came out of all of these. The WHO resolution in 2019 asked for accountability. They wanted reports every couple of years. So in response, the WHO Patient Safety Flagship had a global consultation and created a patient safety action plan that included a very strong patient and family engagement component. As I said, they want it built into every structure and to have it as part of community and national oversight and global planning. So this is the way that the Patient Safety Action Plan is laid out. There's 7 strategic objectives. very broad, very comprehensive. Number 4 is engage, empower patients and families to help and support the journey to safer healthcare. And there's I'm just showing you this picture, but the Global Patient Safety Action Plan framework is 5 strategies for each of those 7 categories. So these are the patient engagement strategies. And obviously this is a lot of words, but engaging patients and families to co-develop policies and plans to learn from the experience of patients and families. That is to have them report, have them involved in the system of healthcare so that they can use their experience to help improve it. Building the capacity, both in the community and within the healthcare system, and as individuals. Establishing the principle and practice of openness and transparency, that is including not just full disclosure, but informed consent, giving people access to their medical records, allowing people to report through incident programs, all the way up until having informed and ethical discussions with families if something goes wrong. And finally, just informing and educating patients and families so that they can manage their own healthcare and really understand what's going on. Some of the background on this is the WHO framework on integrated people-centered health services. The action plan endorses that program and wants to use its strategies. And here they are. They're very similar to the ones that are in the action plan, with a slightly different focus in some ways. The Global Patient Safety Challenge, Medication Without Harm, that I was involved with, that Hussein mentioned, has been, I think, a big catalyst for this. It's very patient-centered. We had a whole category that I led on patient and family engagement and medication safety, which of course is critical. So it's got many, many tools, including these technical reports. The 5 moments is a tool that mirrors the 5 moments of hand hygiene that you're all probably familiar with. And it has an app that goes with the 5 moments, which is called WHO MedSafe, that you can download for free on your phone. So these are the 5 moments. It's a collaborative tool for patients and their prescribers, so that patients can ask questions, they can have a conversation, and some of them patients can reflect on their own, but it is intended to be to help the process of collaboration. As I said, the earlier challenges, patients have been very involved in them. The 5 moments for hand hygiene were created for providers, but patients use them, and patients, as Hussein said, have been some of the most active endorsers. Same thing with safe surgery, and the Patients for Patient Safety group created this tool to go along with the safe surgery campaign, to have questions that patients ask before and after surgery, to help them have a safer surgery. Some of the other tools that are available that are not WHO tools, the Patient Safety Challenge mentions a charter, emphasizes, in fact, having a national charter for patient safety. And this is an example. This is one that we drew up, that World Patient Alliance has sponsored. It's basically the sort of content that a national charter would have: the right to safe, timely medical care, the right to respect, the right to not be discriminated against, all the way through to the right to having your opinion heard. These are some other materials. The AHRQ, Agency for Healthcare Research and Quality in the US, does a lot of very simple, good patient engagement materials. These, again, are intended to be mirrored tools for both patients and their healthcare providers to use. So the patient can be prepared, write down questions, ask questions, speak up, just tools to help them do that, bring their medications, and then a poster to explain the extent of the problem, because most doctors are really unaware of the extent of the problem. And it has other tools for doctors to engage with patients, like TeachBack. If you go to this web page, it has a number of different tools, like how to set up a patient family engagement committee, which is again something that the Global Patient Safety Plan endorses. A lot of things that can be done pretty quickly and easily if they're known. One that is important to me, because my own son died from failure to rescue in a hospital. That is, he had a medication error and reaction, and it was not recognized, which is called failure to rescue, as you all know. Josie King, condition H is sort of the basis for patient and family activated rapid response throughout the world. These are mostly in English speaking countries, but again, it's a fairly straightforward program that can be instituted in the institution, and is a lifeline for patients if they are having communication problems with their bedside caregiver. And these are some of the signs that this was intended. It's called the Dutch Early Nurse Worry Indicator Score. So it's just basically nurses' intuition, but there are also things that patients can look at, and the subjective observations. They don't have to have vital signs to say this patient is not doing well. It's very helpful for patients and families to have a tool like this to know what could go wrong. And then finally, Open Notes, the idea of that everyone should have access to their medical record. This organization has worked diligently on that theme in the US for about 20 years. And they finally, it has finally happened. By law, everyone has access to their medical record in a timely way in the US for free. So this is something you can use. They advocate for this. They have lots of tools and ideas. It's just a website that's really good for that kind of transparency and disclosure. These are just a few things going, more advanced. Patient roles in quality improvement. The patients can be involved in accreditation, root cause analysis, on committees, patient-reported outcomes. You've probably heard of these measures and surveys. You may even use them. Reporting events, patient safety in the community, which Regina will talk about more. But basically, health literacy, having patients more involved in their healthcare facilities and in the running of them and knowing how they work. And then the importance of civil society organizations. There are so many roles that these organizations can take, and they are a very valuable resource. So going back to the Patient Safety Action Plan, this is the first target that we have, that the number of countries that will have a patient representative on the governing board in 60% or more of its hospitals. So the idea is, how many countries will we have doing this? How quickly? That's our first goal. And that's, again, a very straightforward one. There are other more advanced indicators. You can see them here: policies and guidelines, networks of patient advocates, patient and family advisory committees. What else do we have? Disclosing adverse events and patient and reported outcomes. And then the score on the patient safety assessment tool. Now I'm just going back to these slides that I shared earlier, because it is a very long link. If you want to join the Patients for Patient Safety, apply to join the Patients for Patient Safety Network. This is the link, or you can go to my Twitter feed in the next few days. I don't have it up yet, at at @HASK and find it there. And you can join the Global Patient Safety Network listserv, which is an immensely valuable resource. So I just want to conclude with this quote from the Patients for Patient Safety program. The patient and family are the only people who are present throughout the full continuum of care. And to achieve changes with lasting impact, the patients must be at the very center of the quest to improve patient safety. That was not so obvious in 2004. It's become more evident now, but we still have a way to go. So put patients at the center, and I don't think you can go wrong. Thank you. So I am going to now turn it over to Regina, and I'm going to share her slides for her because we've had a few little technical difficulties getting set up. Let's see, there it is. Try that again. Okay, here we go. Okay, Regina.
Yeah, hi. Helen.
Hi, let me get you back to the beginning here. Is this the beginning, Regina?
No, not yet. Go to the first slide.
Is that it?
That's the last one. That's the last
Oh,
one.
this is the last one. Okay, there we go. Okay. Okay, so I'll now turn it over to Regina Kamoga from Uganda, who has Hussein introduced very nicely earlier, and she's going to talk to us about community engagement and patient safety. Regina?
Yeah. Thank you very much, Helen. Greetings from Uganda. I'm very delighted to be part of this webinar today, discussing a topic that is close to my heart. Just before I go on, Uganda is a beautiful landlocked country located in East Africa on the edge of the equator, positioned in South Central Africa, bordered by Democratic Republic of Congo in the west, Kenya in the east, Rwanda in the southwest, Sudan in the north, and Tanzania in the south. So you're very welcome. There are very many tourist attractions. Please come to Uganda. Going to patient safety. Just like any other country or low and middle income country, patient safety has become a public challenge. And according to WHO, patients and their families suffer every day from preventable adverse events. As we've heard from our previous speakers, Helen and Hussein, they've ably given us these statistics. Particularly in Uganda, this situation is made worse by, first of all, the lack of sufficient data on patient safety in Uganda and Africa generally. This is also coupled with the fact that we have dysfunctional healthcare systems with inadequate capacity to ensure patient safety and the health provider safety. This has also been made worse by the COVID-19 pandemic. We also have a weak patient safety culture, supply chain challenges that lead to interruptions in critical services, weak medicine, regulatory, and pharmacovigilance systems. It's in Uganda that you can just go to a drugstore, a pharmacy, and get you go to a pharmacy and you can get a prescription drug. You can as well just say, I feel like I have symptoms of diabetes, hypertension, and they'll go ahead and give you the prescription without diagnosis. So that impacts patient safety. The poor reporting culture, with poor patient follow-up, inadequate policies, HR capacity, overcrowding, ill-trained and unqualified healthcare professionals. We have so many mushrooming medical training centers, training people. So we've ended up with many, I can't say quack doctors or healthcare professionals. Then the issue of paternalism is another big issue. Paternalism on the side of the doctor, this concept of where the doctor knows it best and the patient is just a passive receiver of care, but also the patient looking at the doctor as a small god. So that also comes in with a lack of a strong patient voice. Then Helen?
Yes.
Yeah,
Is this the right slide?
yeah, that's the right one. Okay, then the issue of vulnerability of the patients. In Uganda, we have very many vulnerable patients. Their vulnerability stems from so many reasons, as listed: the double burden of communicable and non-communicable diseases, poor access to healthcare, very many healthcare inequalities and disparities, and very many marginalized, low literacy, low health literacy, poverty, stigma, and discrimination. And all these impact their health-seeking behaviors, which lead to late diagnosis, self-medication, exposure to substandard and counterfeit medicines, and seeking alternative care from traditional practitioners. These are very many in the community, and because they're very accessible, their relationship with their patients, in quotes, are very good. So you find that, and very accessible, so many people resort to these traditional practitioners, where patient safety again is at a very huge risk. All said, the ministry, there have been some efforts, so to say. Our health sector development plan emphasizes patient safety as a priority intervention. And a number of documents have been developed: the client charter, the patient charter, many guidelines. There's been a survey which has been conducted, but of course we need an extensive one which gives us the extent of the problem. A patient safety policy is ongoing, the process is ongoing, and also a patient rights and responsibility bill which seeks to end detention of patients. Indeed, quite a number of patients were detained, especially during COVID, with huge bills being given to patients, where patients even ended up, they're having their dead bodies retained in hospitals because they failed to pay these bills. So this law seeks to end such unethical practices, especially by private. It's yet to come into law soon, and we hope that it will improve patient safety. I think it would be very unfair for me to end this presentation without telling you where my passion for patient safety stems from. It stems from experiences I've encountered at personal and family level with near-miss incidents at personal level. At the community level, I've seen and witnessed patients being harmed, disabled, or losing their lives. My late mother, almost died due to a medicine overdose for her hypertension drug, and was only saved by my young nephew, who was health literate, and was able to identify the issue before it was so late. I also narrowly survived childbirth. So these have actually inspired me to advocate for patient safety and motivated me to do the work that I've done. And I was very lucky to be part of the WHO Patient Safety Program way back in 2011. Believe me, this was a life-changing experience. The stories that were shared by participants in that meeting really opened my eyes to the fact that patient safety was not only a Ugandan issue, but a global one. And indeed, as most of you have heard from our previous speakers, and this marked the beginning of my long journey towards patient safety advocacy. a journey that has not been easy. Quite many challenges other patient safety advocates can also testify. And for me particularly, especially the paternalism of the doctors. You know, the doctor knows it best. I've been intimidated, chased out of meetings. You know, patients being looked at a recipient with just a body and mind. I'm not offending, I'm not intending to offend any doctors on this, but you know, this is an issue in many places. But it's nice to know that increasingly patients are being recognized, and I know that we'll move into the right direction. So this marked the beginning of my long journey for patient safety. That brings me to why patient and community engagement in patient safety. This cannot be overemphasized. The power of patient and family engagement, patients and community engagement cannot be overemphasized for so many reasons. Helen has mentioned them, Hussein has mentioned them. We know that they play a very critical role especially in patient safety. And at Chain, we recognize this. And I've involved all the different stakeholders, right from the young children, because we know that if you involve the young people early in life in patient safety, then they are great ambassadors and they can easily adapt to behaviors. And I mean, why patient safety? We know that our healthcare systems cannot cope without engaging patients. And also we need to be reminded that when things go wrong, they're the ones who suffer harm. They need to be empowered. They need to know their rights, because it's them who suffer. It's them who go through this pain every day on a day-to-day basis, interface with the healthcare system, navigate from one point to another, transition from one point to another, and interface with all these healthcare challenges on a day-to-day basis. So their involvement and empowerment is critical, and also to enable them to demand for safe and quality healthcare services. And particularly where I come from, where, like I said, our healthcare systems are still dysfunctional and need to be improved, so that the demand from the patients will definitely make a difference. So Chain has recognized this, and we have incorporated patient safety, integrated it in all our work, in all our programs. We support orphans and vulnerable children with integrated patient safety. So we do programs in the schools. But what do we do? What's the process? Our process involves conducting needs assessments on patient safety with patient representatives and village health teams in different communities, because we know that it is at that level, the lower level, the community level, where the real practical realities are, where we have the disadvantaged, the patients, those without a voice, those whose voices need to be amplified by the patient advocates. So we do the prioritization of needs, identifying structures to work with, identifying partners. Our process also includes meeting with partners, drawing plans, community mobilization, patient engagement and empowerment, and follow-up activities and report writing. Our key stakeholders, like I said, come from the community. Like I said, this is where the practical realities are. We involve the community-owned resources. These include the religious leaders, the political, cultural leaders, community extension health workers, the patients, the families, the school children, the teachers, the youth out of school, and the lower level health facilities. Again, to emphasize, this is where the practical realities are. This is where the issues are. So it's important that we recognize. And many times, this is the glaring gap. This is the missing gap in all our interventions. So it's important that we emphasize these stakeholders. The approaches that we use at Chain include community outreaches, music, dance, and drama, remember I talked about low health literacy and low literacy. So we use appropriate tailor-made, approaches to ensure that we reach our people. We use debates, essay writing competitions for schools, media engagement, press conferences, newsprint for the different stakeholders that I told you that we work with. You can see these are our village health teams after learning, after being, this was a hand hygiene campaign. After getting the knowledge, they go back to the community and share this knowledge after learning. Then also chain does the follow-up to find out if the information has actually been transmitted. We do the community follow-ups in the community where they share their experiences and challenges. Here was a tippy tap, this is a simple tool that we use for washing hands. It's easy to use and very relevant now, especially with COVID-19, where we are told to wash our hands. Helen, next slide, please.
Okay. Next slide after this one.
Yes. I've finished the approaches, the sharing of the knowledge, now the patient and debate on medication safety. Yeah, the community follow-ups. Yes. So again, that was a community debate. What debating? These are community members debating on medication safety. You can see the two groups, and very effective at that level. We have judges here determining who is winning, and it's very, very interesting. When you visit Uganda, you'll be engaged in such activities. Then we do music, dance, and drama here on World Patient Safety Day. Next slide, Helen. Again, with music, dance, and drama, we use the slide before. Okay, yeah, basically that was World Patient Safety Day. We're using drama to reach out to the community. The issues include medication safety, hand hygiene. We involve school children to ensure that we raise awareness about patient safety. Next slide, Helen. And next slide, there we're killing two birds with one stone. Again, community. Next slide, Helen. Yeah, again, that is World Patient Safety Day. We try to mobilize the community. We are marching on our roads with the school children, with a band to raise awareness about patient safety. Next slide, Helen. Yeah, the impact. Our work has not been without impact. We work with Makerere University and other stakeholders universities. And you can see in that cross-sectional survey where 97% of the participants were able to perform all the 5 steps of hand washing correctly, and 79 remembered to use soap and water to wash their hands. Next slide, Helen. Again, in Busukuma sub-county, we had a campaign for the schools, sensitized on hand hygiene, and 75% of households have adopted and constructed tippy taps in their homes and are able to demonstrate proper hand washing with all. And students have created a multiplier effect. More than half of children in school influencing construction of hand washing facilities in their households. And according to the VHTs, reduction of cases of diarrhea were reported by VHTs in the community. Next slide, Helen. Our work, we've supported the establishment of patient safety networks. In Uganda, we have many patient safety advocates. Again, inspired in Nigeria, Kenya, Burkina Faso, and also Cameroon, where we're talking with some of our colleagues, trying to start up patient safety initiatives. We have Frankie working in Canada, but also coordinating people in Cameroon to ensure that they start up patient safety initiatives. So we want to create a critical mass of patient safety advocates. We've have patient safety partnerships with ministry, and we've organized quite a number of symposiums with the ministry, with National Drug Authority, IDI, Nottingham University, MyClimate, and other key stakeholders. Next slide. We've organized national debates with Medical Face International. Here we mobilized over 600 children from 20 schools in Kampala, PG, Wakiso, and Mukono districts in Uganda to acquire knowledge, and the winners are awarded with primary healthcare boards. They use these healthcare boards to post information on patient safety, which empowers them on patient safety issues. Like I said, children adopt to behaviors very early in life. So they adapt to changes. Adults, sometimes it's difficult to change them, but the children, in our experience, when they learn a practice, they are better able to adopt it in their life. Next slide. Yeah, there again, we're going into schools to go with healthcare professionals and talk to these children. This was before COVID, so that's why you don't have the masks. So we go to the schools and talk to them about different issues, and also engage the head teachers in these schools. Next slide. So our recommendations for successful patient and community engagements. We want patients and family and health professionals to work together to engage and empower patients to effectively manage their own care and make behavior changes in a non-tokenistic manner. We know that sometimes the engagement of patients is not meaningful. So we want it to be more meaningful, and their views taken, their voices heard, and their issues incorporated into policy and implemented as well. For them to be recognized as partners, we want multifaceted approach where all the stakeholders, because no one can do it alone, we need all these stakeholders to come on board. Next slide. Next slide. Next slide. Okay, key messages: sustain advocacy and become a voice to the voiceless on patient safety issues, the culture of safety that incorporates the patient as a care team member, not a passive receiver. They're not actually passive receivers of care. Believe me, patients have a mind, not just a body. So we need to build and strengthen community networks, sustain frequent communication, open discussion between these stakeholders to improve the patient-doctor relationship, and as well as continuous engagement and empowerment. We want to create a critical mass of patient safety advocates. Thank you very much. And let's start early, the interventions in life. Thank you very much for listening to me.
Yes, thank you, Regina. Thank you very much for your very excellent presentation outlining how patients and families can contribute in the work of patient safety. So we are now in the last 10 minutes of our workshop. If there are any questions, we just have 10 minutes. So let me see. We have a question, and which says that, can we request for Helen's slide on patient safety? Well, as Lamia has already mentioned, the whole of this webinar is recorded and it will be available on the Saudi Patient Safety website. A link will also be sent probably to them to all the participants, so you can really access anybody's presentation, with video and voice as well. Yes.
Yes, Mr. Hussein, there is one question in the chat saying, what are the criteria you have to use to select patient safety champions?
Yeah, so can I, refer this question to Helen? So what is the criteria to become patient safety champion?
So the criteria really are your interest, your dedication to patient safety and patient engagement. I mean, the mission of PFPS is very specific. It's patient engagement and patient safety. So if you are a healthcare provider who is dedicated to patient engagement and you have goals and ideas about patient engagement and experience, please apply. And I'm just typing in the chat. I'll send you my email address so that I can, if you write me, I can send you my slides and I can send you any of this information that you would like as well, because I know those links that I put in the program are very long.
All right, so Helen, one more question. It's related to the Global Patient Safety Action Plan. So, what are the next steps? We have a plan. What are the next steps? When will this action plan be implemented at country level?
The countries have to implement it themselves. The healthcare providers, the facilities, it's really up to the individual providers, facilities, communities, and countries to do that. All WHO can do is help facilitate and to measure, to see how well people are doing. So we're trying to create networks. You can see what Regina has done with networks of patient advocates in Africa. If you join the PFPS network, we can put you in touch with other people in your region. And help you, perhaps meet other providers and people in your country. But basically, if you look at the framework, it's fairly detailed. And then there are materials like the ones that I had in my presentation. There are materials that help you do those things. I hope that is helpful, but it is, it's fundamentally ground up. That's how we're doing it.
Right, thank you. So there's another question that, the progress in implementing the patient safety program in the Middle East, especially Arab countries. So since I am also based in the EMRO countries, so I would let you know that in EMRO, the WHO EMRO office based in Cairo has basically initiated an initiative called Patient Safety Friendly Hospital Initiative. So this is something where not only the healthcare providers can work and the patients can also be part of that program. So I will also, as Helen said, I will also put my email into the chat box. So if anyone wanting to get more information on initiatives in the EMRO region, I would be delighted to answer. Then I have a question for Regina. So Regina, what do you think, what are some of the challenges in your patient and community engagement work?
Thank you very much, Hussein. Many of our challenges include the lack of recognition that patients and families are critical in the health delivery process. So many times they're the missing link. And I'll give an example of COVID-19. Initially, all the interventions bottom-up approach, which in the beginning probably they worked a little, but in the end they realized that the community, the patients themselves, the public needed to be involved. And that's when they remembered that they need to be, for this to be successful, we need to include them. And eventually a strategy was made, especially in Uganda, to engage the community, the community-owned resources that I told you about. The other challenge is that when we are involved, it's not meaningful. Then the lack of interest in patient safety. So we don't have many people, partners supporting patient safety. So funding for patient safety is still very low. We hope that by the global action plan will help bring in new partners to recognize that patient safety also needs to be given attention. In terms of research, we need research. You see there's lack of data, especially in low and middle income countries. That impacts on the quality of interventions because they're not informed by they're not evidence-based. So we need more stakeholders to come on board and be part of patient safety.
So, Regina, what do you think? How can patients be supported at the community level?
Yeah, at the community level, we need more empowerment. We need to empower the patients more, like I said, because the low health literacy and the low literacy, tailor-made interventions have to be, but this requires for more partners to join and empower, because they need to be empowered, to be able to engage, to be able to increase their voice, to be able to be part of the policy making, process. But right now, because they're not empowered enough, even when they're offered those seats, they don't know what to say. They're not policy literate, so they lack the skills, the confidence to be part of that process. So they need to be empowered. We need more partners. We need funding for patient safety interventions and initiatives right from the community level. We need a bottom-up approach to be applied.
All right. So thank you, Regina. Thank you, Helen, for your kind presentation and input. It's just less than 2 minutes left, so I hand over to Lamia for the closing of the workshop.
Thank you very much. So I would like to thank you, Mr. Hussein Jeffrey, Ms. Helen Haskell, and Mrs. Regina Mariam Kamoga for addressing this interesting topic. And on behalf of the Saudi Patient Safety Center, we would like to thank our speakers and the audience for their active participation. And as part of Saudi Patient Safety Center's efforts to provide all audience with timely topics and interesting speakers, we'd appreciate it if you would fill the evaluation survey provided at the end of the session by email. Thank you for joining us today, and we look forward to welcoming you back in the future webinars. Any closing remarks from your side, Mr. Hussein or Ms. Helen or Ms. Regina?
Thank you very much. We have enjoyed the lively conversation. It's been a privilege to address this group.
It's our privilege.
And I think that there is some appetite. I can see in the chat as well. The people are quite interested in patient participation and engagement, and I think we should have more of such, webinars involving patients.
Yes, hopefully.
Thank you.
Mrs. Regina, any last words?
Very delighted to be part of this. Let's have more of these because they increase the knowledge on patient safety.
Yes, sure. Thank you very much. Thank you, our participants. See you in our future webinars. Good night.
Thank you. Thank you, Lamia.
Thank you.
Thank you. Bye-bye, everybody. Good night. Allah Hafiz.
Bye.